My name is Lindsie Hellwig. I am a board-certified nurse practitioner here at Ozark Regional Vein and Artery Center, and today we will be talking about vein and artery testing. So vein and arterial disease are progressive disease processes, so they are not going to get better on their own. Whether they get worse within weeks or years from when you develop them, that is different for every patient, but our goal is to catch those disease processes early so that we can improve our patient's quality of life. We want to prevent disease progression to wounds and disease progression to activity intolerance. So by treating these things earlier, we can prevent those things from reoccurring, giving you a better quality of life and longevity. Vein disease in the US is a fairly common occurrence just because of lifestyle factors and as well as genetic factors. You can have vein disease without arterial disease, and you can have arterial disease without vein disease, but a lot of the risk factors that cause those diseases overlap. For initial testing for vein disease, it is a simple ultrasound that will take a look at the deep veins as well as the superficial veins to see if there's any refluxing blood or blood that's flowing the wrong way in those veins. For arterial disease, initial testing could include something called an ankle brachial index, where they take blood pressures on each of your arms and on each of your legs, put those into a mathematical equation to gauge your risk factor of a stenosis, which is a narrowing of the artery, or an occlusion. If that testing is abnormal, then you would be moved on to further testing, which could involve a CT scan with injection of dye to visualize those vessels, and or running a catheter into that specific vessel and putting dye into it to look for occlusions. For the ultrasounds, it's just come as you are. They're pretty simple tests that are done in the office. They're fairly quick, non-invasive. They don't involve a lot of discomfort or pain. So if you're having symptoms of activity intolerance, heaviness in your legs, wounds that are not healing that you've had for an extended period of time, I would highly encourage you to come and be evaluated, because these are things that don't have to continue to bother you. They are things that we can do to treat these and make these symptoms better to improve your quality of life.